Now for the next type of deformity which we'll be looking at in orthopedics, this is what is known as a swan neck deformity. Swan neck deformity. Alright. Now swan neck deformity, of course, is literal, of course the deformity is looking like a swan neck, do you understand? But for students, maybe you might have been wondering, okay, which part of the body, okay, did this actually occur and all of that. So this is a swan neck deformity, and it's actually a feature of people suffering from what? Joint diseases, joint inflammatory diseases like rheumatoid arthritis. Okay, so you can see it. So what we have in swan neck deformity is a condition usually affects the fingers. So the joint is now looking like what? A swan's neck. You can see it. I've already circled it. So what it looks like is hyperextension of the what? Proximal interphalangeal joints. For these ones, they are hyperextended. Okay. There is flexion of the what? Distal interphalangeal joints. Okay. So the fingers curve upward in the middle and downward at the tip. Hence, it is now looking at the neck like the neck of a swan. You understand? So causes most commonly is what? Rheumatoid arthritis. That's why I said it's a diagnostic feature of rheumatoid arthritis. Also, if there's untreated mallet finger, ligament laxity, trauma to the finger joint, neurological issues causing muscle spasticity, then sometimes you see it in syndromes like the Ehlers-Danlos. Now, Ehlers-Danlos is a syndrome that everything is so flexible in the body, So symptoms: there's difficulties bending the finger, snapping or clicking sensation during movement, stiffness or loss of functions, cosmetic concerns due to finger shape. Okay, swan neck deformity. So treatment options: splintings. Okay, physical therapy just to improve the flexibility. Then if there's any inflammations coming up, of course this is coming as a result of inflammations, right? Rheumatoid arthritis, so use anti-inflammatory drugs to treat the underlying arthritis. And sometimes they do surgeries like what? Tendon realignment, joint replacement, joint fusion surgeries and all of that. Okay, so that's it for this concept in rheumatoid arthritis.